Hello dear all. So in this lecture we discuss second chapter from Carol Dunham's book Homeopathy, the Science of Therapeutics, and the name of the chapter is Antagonism between Homeopathy and Allopathy. So we discuss what are the concepts which are discussed in this chapter. So I have tried to cover each and every small points which are given in this chapter. So first aspect is historical and second aspect is philosophical. So we discuss the antagonism between homeopathy and allopathy. So justify the position of homeopathy and allopathy. So this is divided into two aspects, historical and philosophical. So we justify each and every science, homeopathy as well as allopathy. So at this point we consider and homeopathy as well as allopathy a science, and we try to justify, and let's see what is the outcome of this. So Dr. Haneyman is considered as reformer of medicine. Very important point. Dr. Haneyman is considered as reformer of medicine. So here medicine means the medical science. Here medicine does not mean the medicines or drugs. So Dr. Haneyman is a great reformer. Why? Because so he is the first genius person who considers that homeopathy, which is based on the fundamental law, that is similia similibus curantur. So the most important aspect is this, that the medical science is treated by the medicines which are based on law of similars. Second important point, the medicines administered here are in the very small doses, minute doses, and they are potentized and are in the dynamic form. So, apart from this, the medicines are tested not on lower animals but on healthy human beings. So, this is the fundamental difference between the current system which existed at Hanneman's time, called as old school, and Hanneman's homeopathy. So, Hanneman is considered as reformer of medicine. Gallen's teachings influenced the field of medicine from 500 AD to 1500 AD, that is almost 1000 years. Gallen advocates allopathy and antipathy. Dr. Hanneman was scholarly genius who challenged Gallen's teachings. So Dr. Hanneman writes in his Organon of Medicine, Ode Sapere, that is dare to be wise. So he was doing the challenge of Gallen's teaching, which long lasted for more than 1000 years in the field of medicine. So, what is the historical aspect? Now we will consider. Dr. Hanneman told Dr. Huffland that he was convinced about uncertainty about current practice of antipathy and its injurious effects of many methods. So many methods existed under the practice of antipathy. All of you are aware of bloodlettings. All of you are aware about the derivation methods. Then the various extraction of the fluids from the body. So these were very injurious procedures existed at Hahnemann's time, applying leeches to suck the blood and draining of the vital fluids were very important and methods which were practiced at Hahnemann's time under the antipathy. So Dr. Haneyman didn't continue his practice for just earning his living in spite of great necessity as he had a large family. So Haneyman did not move from his aim that I will not practice such a injurious medical practice. Dissatisfaction of current old school practice led Dr. Hanneman to think about any other option if it existed, for this prevailing treatment was not curative and hazardous, and large doses were used. So he left his practice and devoted himself to study some collateral sciences. Example is chemistry. And all of you are aware that it is said that if Hahnemann would not have become a homeopath, he would have become a chemist. So Dr. Hanneman has done extensive translations in the chemistry as well as he performed various experiments in chemistry. Dr. Hanneman would not have become a homeopath, he would have become a chemist. He then started doing literary work. He started writing books and did translations. In 1789, he started translation of Cullen's Materia Medica. He read Cinchona cures malaria because of its bitter taste. So he combined most bitter substances and gave it to treat malaria. But cure didn't take place. So he thought of taking himself. To his surprise, he got chills, fever, and malaise, symptoms of malaria. So he wanted to confirm Cullen's Materia Medica, what was written about the experiment. So Dr. Hanneman combined most bitter substances and tried to treat malaria, but there was no cure. So he just thought of taking himself, and to his surprise, he got chills, fever, and malaise. His logical mind arrived at conclusion. Febrile property of cinchona cures malaria. So cinchona is curing malaria not because of its bitter taste but because of the febrile property. That means it produces fever and chills. He also knew use of Merck in syphilis. So he further thought that such specific remedies should be increased in number so that they can be used for medical practice and can anticipate success in medical practice. So this was the first thought generated in Dr. Hanneman's mind about drug proving. What was falling apple to Newton and swinging of pendulum in church of Pisa to Galileo, cinchona bark was to Hahnemann. First need of drug proving, where Dr. Hahnemann started proving drugs on himself and family members. And then this drug proving was done on his students and his disciples and colleagues. So from 1790 to 1805, he had proved 60 drugs on himself. He became sure of principle of similia. In 1796, the discovery was already made by him. So while he proved the drugs, he also started dispensing these drugs to the patients by applying the principle of similia. So he was so sure about his law of similars. The name of essay was An Essay on New Principle to Ascertain the Curative Powers of the Drugs, an examination of new principle. This In this essay, Dr. Haneyman discussed the cinchona bark experiment and declared homeopathy to the world. In 1805, he has written the book Medicine of Experience. So, in 1810, he published first edition of Organon of Medicine. And what was the name? Organon of Rational Art of Healing. So the book Medicine of Experience, published in 1805, is called as precursor of Organon of Medicine. Dr. Hanneman was convinced that prevailing medical system needs to be improved, and he retired from his lucrative medical service practice, which could have fetched lots of money and adequate support to his large family. So he wrote a letter to Dr. Hufflan saying that if experience to show you my method, the best then make use of it for benefit of mankind and give God the glory. So this was a sentence he had mentioned to his friend Dr. Huffland, that this is the method, this science of homeopathy is going to benefit the humanity and give God the glory. It means that homeopathy is giving and glorifying God. So is his tremendous trust, faith on his homeopathic medical science. So Dr. Hanneman is so sure about the law of similars and the need of drug proving, more and more drug proving. Dr. Hanneman was criticized personally, which was really unfair, as criticism was on his system but not on him as person. It should have been like that. But at that time he was criticized. He was accused for breaking the law which forbids the practitioner against preparation, compounding, and sale of medicines. He explained he was also apothecary. Apothecary means pharmacist, a high status German who manufactures medicine. At that time, apothecaries in the society had a very high respectful position. So Dr. Hanneman was himself preparing the homeopathic medicines. So he was an apothecary. He was expert pharmacist, and he told medicines are not compound substance. They are single and pure. So Dr. Hanneman was very sure about the purity, genuinity of the drug substance, and he was claiming that these medicines are I am preparing are single form and are pure, no adulteration. In 1820, he was permitted to give lecture, but his lectures were more on criticism to allopathy than teachings of homeopathy. He then shifted to Cothen, where he was permitted to practice homeopathy. He was called as divine teacher. Now we start discussing the philosophical aspect. So up till now we have discussed the historical aspect. So very interesting situations occurred in Dr. Hanneman's life, and it is very important to understand the daring Hanneman had done, and he was so honest and so faithful to his system which he had invented, homeopathy. Cause of disease is material. Old school physicians strongly believed that the cause of disease is material. Material means it is nothing but that the faulty fluids is the cause of disease. So they had thought that during fever, all these Western people who have got white skin, that it gets flushed and there is redness which occurs. And they had thought that this is because of excess of faulty blood during the fever. So they started doing the draining of blood by venisections or applying leeches. So they considered the cause of disease material. By dogmatics, so who are the dogmatics? They are the physicians who search the cause of disease and they claim that they cure disease. So these physicians always search the cause of disease. And what cause of disease they search is nothing but material cause of disease. Empirical physicians give medicines based on past experience and past experiment. And the third type of methodist are the physicians who wanted to know the nosological name of the disease for treating the patients. So these three variety of physicians existed during 18th century medicine. The physician searched the cause of disease. Galen considered cause of disease as accumulation of blood, lack of animal spirit. Sydenham considered pleurisy due to inflammation of blood and removed by bloodlettings. Hippocrates said clinical observation is essential. So, father of medicine Hippocrates had claimed that the bedside observation and clinical observation is highly essential. He gave four humors of blood, that is yellow bile, black bile, flame, and the four humors as the cause of disease between the blood, yellow bile, black bile, and flame. There is a lack of balance, and deficiency of any one of these factors causes diseases. Dr. Haneyman came with different idea and showed lacuna of this method and said it's not a rational system. So Dr. Haneyman very strongly he said that this is not a rational system and he considers that all these defects and causes the diseases is not the reason for the diseases. Dr. Hanneman said philosophical approaches of Hippocrates and Galen have errors. Example, physician treated pleurisy by bloodletting as accumulation of blood is proximate cause and not essential cause of disease. But actually accumulation of blood is due to result of essential cause. Dr. Hanneman said, removal of result will not cure. Exact nature and causes and modification of natural dynamic forces. Say in acute disease, weather changes cause the what we say the fever cough cold due to the change of weather or getting wet in the rains patient gets fever or by exposure to sun he gets sunstroke. So these are the dynamic forces which causes acute diseases and chronic diseases are caused by again dynamic factors, that is miasms, which are nothing but defects in the body or the dynamic disease producing cause or power in the body. These dynamic forces act on organism are essential causes and removal of these dynamic causes is the rational method. So he is so strongly advocating that there are errors in the Hippocrates' teachings, there are errors in the Galen's teachings, and the cause of disease cannot be material, but the causes are the natural dynamic forces which gets modified and they act on the human beings and human beings suffer from acute disease or chronic disease. So for this treatment give specific remedy. Now what is this specific remedy? which reaches the abnormal behavior of vital force and causes cessation of morbid phenomena and brings vital force back to normal. Specific remedy acts under specific laws and shows specific action, that is, drug proving the experiment through which we can understand, we can come to know the effects of this remedy on the healthy human beings. And when these symptoms are noted, and they form homeopathic materia medica. So these symptoms from homeopathic materia medica are then matched with the symptoms of patient. So this specific remedy is not specific for disease, but it is specific for the patient and his symptoms, which are matched with the symptoms in the materia medica. So, the concept of specific remedy is homeopathic specific remedy is the one which is given on individualization, not on the name of the disease, not on the just symptoms of disease pathology, but it is prescribed on the symptoms of patient. So the abnormal behavior of vital force gets reflected in the form of the abnormal symptoms in the patient. So these are first the general symptoms and later the particular symptoms appear. Old school physicians used diuretics, emetics, and bloodlettings, pseudopherics to effect so-called cure. He claimed that these are rational medicines. But these drugs were not at all curative. These drugs are just, or some procedures are just removing the effects of the diseases. They said cinchona bark cured intermittent fever. So need of such medicine is there which are specific. So who is saying this? This is the old school, or the physicians of the old school are saying that there is need of such specific medicines like the one what we call homeopathic specifics, which would cure the diseases. So, at one time, they say that the cause of disease is material and they are treating by applying leeches, doing venisections, draining fluids, and at another time, they accept that the need of specific remedies there which can cure the diseases, but they don't allow the proving of these remedies on healthy human beings. They don't accept this. So, this is the antagonism. So, what is antagonism? At one time, old school physician accepts that there is a need of specific remedy, and at another time, they believe on material cause of disease. They believe on various procedures which do not cure the patient, but they are just giving some temporary relief. This is antagonism between homeopathy and allopathy. So the old school, that is the antipathic physicians, understands the need of the specific remedies which are able to cure the diseases. But the way to find out to build his homeopathic materia medica is not acceptable. So at one time they say need of such medicine based on law of similars is there. At another time they disagree with the law of similars and use above mentioned medicines which do not cure. So these procedures, that draining of the ascitic fluid or pleural effusion, do not cure, because if the draining is done after few days again the fluid starts accumulating. So the treatment should be the administration of homeopathic specific remedy which are prescribed on law of similars. So method of search of specifics and their actions. This is nothing but our experiments of drug proving. So Dr. Haneyman established a method to search specifics and their actions. So what is the method he has searched for the specifics is the experiment of drug proving. Dr. Hanneman presented the knowledge to world, but they refused to accept and denounced him on whom the onus lies. So old school denied the science of therapeutics. Dr. Hanneman started to prove the drugs on himself and his colleagues and family friends. So he tried to expand the materia medica. Old school denied the science of homeopathic therapeutics, but at one time they are accepting the need of such specific remedy is essential. Essential nature of diseases is to be studied for rational cure. So study of general symptom is very important. Old school considers disease as symptoms and signs examined by physician. So temperature, pulse, respiratory rate, blood pressure, temperature is examined by the clinician of old school physician and he is treating these signs. Essential nature of disease is general indication which appears first. So the what old school physician is doing is they are measuring the temperature, pulse, respiratory rate, blood pressure are the effects of disease. So what is the actual essential nature of disease? It is the general indications which appear first. So abnormal sensations and abnormal functions appear first during the evolution of any disease. Physician knows the disease through sensibility of patient. Homeopathic physician now tries to know the essential nature of disease by case taking and he notes down the sensibility and sensitivity of patient. Old school physician pays attention to the visible signs and symptoms of disease. Dr. Hanneman insisted to focus on general sensation of patient which precedes material or organic disease. It's the first evidence of disease. So during evolution, the first affected are the general sensations and functions. This is the first evidence of disease. General symptoms are the important present at the onset of disease and they are the essential nature of disease. Subjective symptoms are evidence of dynamic changes with disease process. So this is very important. All these subjective symptoms which are nothing but symptoms of mind and symptoms of body are the evidence of dynamic changes. They indicate the onset of disease and also the disease picture. They are the first symptoms which appear in the evolution of disease. Subjective symptoms are important for individualization and this is possible only by noting down patients' general symptoms. Every patient shows some different symptoms even though suffering from same disease. So second symptoms are followed from dynamic changes to material changes which are objective symptoms. Old school physician notes only objective symptoms. They give disease diagnosis. They cannot individualize the patient. Dr. Haneyman said specific remedy can be only applied through subjective symptoms based on individualization. So Dr. Hanneman is now giving single specific similar remedy. The action of specific remedy or similar remedy is first point, curative power of specific remedy is not in the direct proportion of material quantity. So the higher the similarity of specific remedy, higher is the dose or what we call potency of that remedy is given. Higher the potency means higher the quality, and this is in the inverse proportion to the quantity. Drug exerts more powerful effects on those organs which it has specific affinity when organs are sick or healthy. Small doses of specific remedy cures diseases. So we don't require large doses. Just small dose, minute dose, sufficient to stimulate the deranged vital force cures diseases. Quantitative dose cannot be measured by physics or law of science. So quantitative dose can be measured by physics, but in homeopathy we are giving qualitative doses in the form of potencies which are dynamic in nature. So action of specifics in morbid conditions in the disease state, specific remedy exerts power in small minute doses. Susceptibility of system of man is similar to the specific is the greatest. So there is a maximum susceptibility between the symptoms of the patient and similar remedy. So forces of attraction are present between these two. Symptoms of sickness shall be similar to those which the drug produced on healthy human beings. So we are doing the matching. And what is the eternal truth? There is necessity to increase the specific remedies to acquire knowledges of new specific remedy. So experiment of drug proving is essential. There is necessity to increase homeopathic materia medica. Exact observation is important of subjective symptoms, and study of doses is also important. Drug proving in old school is done on lower animals in large doses and in the crude form. Importance is given only to objective symptoms. Provings done to know the extent of pathology. What is the contrast? Drug proving in homeopathy is on healthy human beings, minute doses, and what is noted are the general symptoms. Provings are stopped when pathology starts advancing. So this was the at-length discussion of this second chapter from Carol Dunham's Science of Therapeutics, the antagonism between homeopathy and antipathy and allopathy. Thank you.